Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about progressions in terms of lower back positioning when we want to bias or have somebody repeat extension type of movements in the lower back region for pain relief and to help centralize a patient's pain. But before I continue, please hit that subscribe button below so you'll be notified about any new videos that I put up here on my channel. So this is what's referred to as a McKenzie approach to back pain. And with this approach, what we want to do is basically identify certain positions that provoke pain or symptoms, or in particular might provoke if somebody's getting peripheral symptoms or leg symptoms. We want to try to figure out, okay, what positions will make that worse? Will peripheralized symptoms make the pain worse? And what positions actually help ease the pain? Now, in this case, what I'm going to show is a progression in terms of an extension bias, which is a very common position that we need to try to move into when somebody's having some back pain. So in a lot of cases, right, I'll see patients that they might present with, let's say, pain into the lower back and pain into, let's say, the buttock region, so some sciatic-like symptoms, and they might even be experiencing some symptoms going down the leg, so perhaps even some pins or needles or numbness. And when they bend forward, those symptoms, they get worse, and when they extend back, they're really stiff. So when they're coming back this way, they're really stiff into that range. Their leg symptoms seem to be a bit better, but it's quite painful into the back, and they're also limited in terms of their range of motion. So in this case, when somebody's presenting this way, when their pain is centralizing and it's somewhat limited, we typically want to move into that position, which will bring the symptoms out of the leg area in towards the back area, but can also be quite sensitive, especially with acute attacks of pain going into that position. So we want to be, to some degree, somewhat conservative, right, in moving into those positions. And so I just want to run through the different ways that you would gradually try to increase extension, again, when there's a loss and when there's centralized pain, when the pain is moving from the leg up into the back area. So I'm going to show you the different stages, so to speak, that are involved in this. So the first thing, I will typically get a patient just lying on their stomach like this. Now sometimes even just this position might be too much for the patient. So in that case, I'll actually put some pillows underneath their pelvis so they're even more in a slightly more neutral or flexed position. So depending on the sensitivity of that, pillows might actually be required. And then what I would have that patient do is essentially just lie in this position, breathe into the lower back, so almost do like some diaphragmatic breathing to try to let some of the muscles that run up and down the spine, these are called the paraspinal muscles, that more than likely are in sort of a guarded or protective position, to start to let go a bit. And you know, this might take 5 minutes or longer. This might be a position that somebody just has to go into for a few days, because again, they're lacking so much extension, right? So again, it might start out pillows, then no pillows, and then from there, I want to see how they do just on their elbows, right? And again, what we'd be monitoring here is, are the symptoms continuing to centralize, right? So they're not going further down the leg. How's the pain doing, right? So as we kind of move into this, although initially it'll be somewhat stiff and sore, gradually that pain should start to subside. So we want to, again, make sure that the pain is moving in the right direction, right? And again, the mobility, as the pain reduces, as the guarding settles down, the mobility should improve. And I might actually have somebody repeat, right, extensions on their elbows and see how that feels. We're going to monitor all of those different symptoms that we talked about. Okay, are symptoms still centralizing? How's the pain doing? Is the mobility improving? Okay, and then from there, I'm actually going to have the patient place their hands on the kind of where the shoulder level is, and we're going to go into some extension type movements. And again, we're monitoring all those different symptoms that we talked about, right? So we want to make sure, again, symptoms are centralizing, pain is moving down, mobility is improving. Okay. If you have any questions, concerns at all for me, feel free to leave a comment below. And please check with a physiotherapist to make sure that this exercise is appropriate for you. Have a great day, and thanks again for watching. Take care.